Hi, my name is Mason Kalinsky. I am the organizing director for Hood to the Holler, and I'm here to talk to you today about how civic engagement is part of a healthy Kentucky. We at Hood to the Holler do community organizing. We go into communities of people all across the state who feel disenfranchised, who feel like politicians don't care about them, don't care about people where they live. And we bring them together to make the changes they want to see. Specifically, we were founded in 2020 on the idea that those of us in the hoods of North Lexington and West Louisville and the hollers of Appalachia have more in common than we do dividing us. And I've found that to be true because I go to a lot of places, a lot of events in those communities. And I hear people talking about the same issues. They're worried about making utility payments. They're worried about paying the rent or paying the mortgage. They're worried that they can't find good jobs in their communities. They're worried that their kids aren't going to good schools. And that's the same thing I hear everywhere. People care about their communities, and having good connections in their communities leads them to building healthy communities and being healthy people. So what we've done is, in our targeted areas, we've been having people's assemblies, which are just meetings of neighbors coming together and talking about the issues they care about. In Lexington, they're talking about the housing crisis. They meet once a month and they talk about strategies that they can use to mitigate the effects in the short term and to make a change in the more long term. So they're working on setting up a mutual aid network to help each other survive the short term, and also a list of actions to petition the city council in Lexington. In West Louisville, they're struggling with gentrification, so neighbors are coming together to address the issues of gentrification and to help help individuals avoid those effects. And in Appalachia, a lot of people that we've talked to have struggled with feeling isolated, feeling like people where they live don't really feel the same way as them, aren't passionate about their communities, but we hear that all across Appalachia. So we're able to bring people who are passionate about making change in their community together to strategize on how to bring that to a larger community. And what we've seen in all of the places we have organized these is more civic engagement. People are more likely to know who their city council member is, who their school board is, people that they can talk to in order to make change in their community, and they feel more empowered to make that change. And our hope is that we will be able to create a Kentucky that is more representative of the people that live here, and empower the people that live here to make the change that they want to see. And that is the work that we've been doing since we were founded in 2020, and our hope is to bring a healthier Kentucky. Thank you.
Thank you, Mason. Appreciate that presentation. It's now my pleasure to introduce you all to our first speaker this morning. Richard Harwood is the president and founder of the Harwood Institute for Public Innovation. For over 3 decades, he has devoted his career to revitalizing the nation's hardest hit communities, transforming the world's largest organizations, and reconnecting institutions to society. He has been recruited to solve some of the most difficult problems of our time, including being called into Newtown, Connecticut after the massacre at Sandy Hook Elementary School. He has written 6 books, many articles, and groundbreaking reports like Civic Virus, Why Polarization is a Misdiagnosis. Please join me in welcoming Rich Harwood.
Good morning. Good morning, Kentucky. I can't hear you. One more time. Good morning, Kentucky. Good morning. Great to be here. First, another round of applause for all those great award winners. And also, I hope you'll join me. You know, not every state is blessed with a foundation like this foundation. Not every foundation is blessed with a leader like Ben. So how about a round of applause for the great work they do? You know, I am very fond of Kentucky, as many of you know. We've been working in Clark County since 2017. We're working now in Owensboro. We've been working a bit in Lexington. We've done work over the years in Paducah. We've done work around Fort Campbell, around the border with Tennessee. So this isn't my first time here in Kentucky. Been here many times and am really glad to be back. Now, we live in serious times, and I wonder if you'll give me permission to talk about some serious topics this morning. Is that all right? Because I think we need to get to work in this country. You know, I've been traveling all across the country, and wherever I go, our fellow Americans, including Kentuckians, tell me the same thing, that we can do better, that we can be better, that we can do better and be better as individuals, that we can do better and be better in our communities, and that we can do better and be better as Americans. As Americans, you with me? As Americans. And as I've been traveling around the country on this campaign called Enough Time to Build for the last year, people keep asking me, well, are you running for office? And I say, no, I'm not running for office, but we have launched a new civic campaign. Because I don't know about you, but I believe that we don't need more divisive politics in our country and in our communities. We need a new civic path forward. A new civic path where we figure out in our communities what we can agree on amid our real differences. Where we can get moving together. Where we can start to do things together. Where we can start to produce results together. And where we can fundamentally restore our belief in ourselves and in one another that we can actually come together as Americans, not as Republicans, not as Democrats, but as Americans to get things done for our fellow Americans, right? And I believe that the work we need is going to have to start in our local communities. And it's why I'm here this morning to support the work of this foundation. Because as you know, Kentucky has lots of assets and lots of great things, but there's lots of work to do in our communities all across this great state. Now, we know that creating change in our society today is not easy. I'm not going to sugarcoat things this morning, right? Many of us came out of COVID worn out, exhausted, and tired. Does that include some of you? And when COVID eased, we looked up and we thought, oh, it's over, or at least it's eased. And we breathed a sigh of relief. Except when we actually looked up, we realized our work was just beginning, right? Our work was just beginning. Inequities and disparities, or many inequities and disparities, did not diminish post-COVID, they actually grew. The lack of trust in our country and in our communities didn't diminish, it actually turned into mistrust, which is even more difficult to address. There is a short supply of hope in our communities and in many of our fellow Americans, and maybe in many of us sitting here today. There's a short supply of hope. There's a short supply of hope. Now, as we've moved forward, we Americans, we have separated and segregated from one another at a faster pace than ever before. Think about it. We make judgments about each other based on the color of the baseball hat we wear. You know what I mean? We make judgments about each other based on the slogan on our t-shirt. We make judgments based on the bumper sticker on the back of our car. We make judgments about each other based on the church we go to on Wednesday night or Sunday morning, right? If we go to church. we make quick judgments, but I ask you, what is it that we know about each other? What is it that we know about what we really value, what we really care about, the types of things that Mason was just speaking about? What do we really know about? We are an anxious, fearful country right now. And it didn't just start with COVID. COVID accelerated and exacerbated things, but I've been studying this stuff for 40 years. It started a long time ago. It started a long time ago. We have politicians and news media and social media who are intentionally manufacturing and stoking division in our country. I didn't say that. Americans told me that, from all walks of life. And I ask you, why are they doing it? Is it for our common good? Is it for the benefit of the people of Kentucky? Is it going to enable us to make more progress in our communities and in this country? They're doing it because they want more votes. They want more viewers and more eyeballs. And what Americans tell me is that we are increasingly confused about what's going on in our communities today. We're increasingly disoriented by all the noise and confusion. We can't tell who to believe and who not to believe, right? We can't figure out what is true and what's fiction anymore. It makes it very difficult to figure out, as Ben was asking us, how can we move forward and find common ground when so much noise and confusion is enveloping our lives? And so we Americans, we're having a natural human response to this noise and confusion. It's not a mystery. It's not a mystery, and many of you know it. It's called fight or flight. Fight or flight. Now, that's not a phrase I made up and labeled what people were telling me. That's a phrase that Americans keep using over and over again as I talk to them. So many of us are so fearful about coming into the public square, of being chopped off at the knees, about being accused of saying the wrong thing, about getting into arguments with our families. Someone was telling me this just last night, that we've retreated. We've thrown up our hands in frustration and moved away from the public square. It's not that people don't care, it's that they don't believe they can safely engage anymore, right? It's not that we don't care. Don't let people tell us we don't care. People care about their health. They care about social determinants. And then others of us have decided, well, things have gotten so heated, we're going to come out and fight no matter what. And we're going to seek to win at any cost. We're going to seek to win at any cost. There is a dangerous vacuum that's being created in our society. I don't know if you see this in Kentucky. I've seen it. I see it in Owensboro. I see it in Clark County, where I'm going tonight to speak tomorrow. I see it in Lexington all the time, where we've done work. That the loudest and most divisive voices are taking over our public square. Do you see it? The loudest and most divisive voices are taking over our public square. And in turn, those of us of goodwill, those of us of good faith, those of us who care deeply about our communities and one another, many of us have moved to the edges of public life. Not because we don't care, but because it's safer there. Because we don't have to deal with all the controversy. We don't have to deal with all the noise. We don't have to be accused of certain things. We don't have to chase down people we want to work with who tell us they want to collaborate with us, but then they don't show up. You know what I mean? Come on. We face, you face, I face a fundamental choice today. I believe our country faces a fundamental choice. I don't think that's overstating it. And the choice is this: will we surrender the public square to the loudest and most divisive voices, or will we come back in and reclaim it? That is the fundamental choice I think we face, and that's what I want to spend the rest of the morning, not the whole morning, just the next few minutes talking about. Now, I was in Selma, Alabama about a year ago, and I was at the Tabernacle Baptist Church, where Dr. Martin Luther King and Ralph Abernathy and others helped to plan the march on Selma and the Civil Rights Movement. I was there to meet with the local NAACP, and we met for about 90 minutes in the very same basement where King and others planned the Civil Rights Movement. we spent about 90 minutes talking about what it would take to rejuvenate Selma. And after that time, an older black gentleman who was sitting directly across from me stopped the conversation. And he looked me in the eye, and he uttered 3 words which I will never forget. He said, "Will anything change? Will anything change?" Just a few short weeks after that, I was 800 miles exactly due north of Selma in southwest Michigan. And I was working with about 60 leaders from across that region. And we were talking about how they could come together and get things done together. And after about 90 minutes of that conversation, a young white woman who was sitting in the front raised her hand and uttered 4 words, which I will never forget. Am I strong enough? Am I strong enough? I happen to believe that we can create change. And I happen to believe that we, you, are strong enough to do it. I say that not because I've written books about it or because I talk about it every day. I say it because what I've witnessed all across our great country. For instance, in Reading, Pennsylvania, where we're doing work right now. Reading, 10 years ago, was declared the poorest community in all of America. It was once predominantly white. It is now almost 70% Latino. It's still poor. We were asked to work with the community to create a community-led, community-driven education agenda. Everyone told us not to do it. It couldn't be done because it was at the height of the culture wars. If you remember these, they're still going on here in Kentucky. The culture wars over education, about banning books, about culture wars over recalling school board members and summarily firing school superintendents, and debates over DEI and critical race theory. You remember all that. It's not that far in the past. In fact, in many communities, it's still happening. It's happening where I live now in Richmond, Virginia. People said it couldn't be done, but that community came together and created an agenda, a shared agenda around education. And it had 9 points. And it dealt with really practical things that people cared about in their daily lives. And 3 teams formed around those 9 ideas to focus on 3 areas: English as a second language, after school and out of school activities, and early childhood education. Scores of people came to do work, much like we're starting in Owensboro, came out to do work together on these 3 areas. And in 2 short years, they've created transformational change. And scores of more people have joined, and the work has spread to other areas. All in a community that people said was too poor to do this. All in a community that people in the Commonwealth of Pennsylvania had left out and left behind. All in a community that people had called Reading the donut hole of Berks County, meaning it doesn't exist. It doesn't exist. They did it. Recently I was there and I asked folks, what are you creating? What are you creating together? And they could have told me about all their strategies and programs and initiatives, which are important and real. But here's what they said. What we're creating is new trust. What we're creating is new common ground. What we're creating are new bonds of doing things. What we're creating are new ways of working together. What we're creating is a greater sense of pride in ourselves and in this community. What we're creating is a new narrative in this town. In fact, one person who had been watching this initiative for a year and a half said, I've been skeptical, even cynical of this thing, and now after a year and a half, I realize it's real and I want to join it. Another woman in the room said to me, we've had a narrative in Reading that said you should flee this community as soon as you possibly can, and now our narrative is shifting to one that you should move here and raise your kids here because this town is coming together and we have pride in it. Reading, Pennsylvania gives me hope that we're strong enough and we can create change. Ben mentioned Newtown, Connecticut. You all remember the massacre there? A young gunman walked into Sandy Hook Elementary School and gunned down 20 first graders and 6 adults. Just weeks after that massacre, I got a call from the mayor of Newtown asking me whether or not I would come and work with the community. The first order of business was to figure out what to do with the school building and what happens to that school. What I learned real quick was that this really wasn't about a building at all. This was about whether or not a community could pivot from trauma and despair to healing and hope. That's what this work was about. The mayor had appointed a task force of 28 elected officials from 4 different governing boards who did not like one another and did not get along. It was a recipe for political disaster. Most people in the community believe we shouldn't even be having this conversation yet. It was way too soon after the massacre. It was just months now after the massacre. But the mayor wanted to move ahead. Every meeting we held was in the city council chamber, in public, where CBS News and CNN and the Wall Street Journal and the New York Times and USA Today and scores of other media covered every move that we made. We were about to make a decision after the 3rd meeting. But I was sitting in my home. At that point, I lived in Washington, D.C., and I got a call from the mayor's office. They said, "Did you see the Wall Street Journal this morning? There's a front page story. 30 teachers from Sandy Hook Elementary School released a public letter saying under no conditions would they go back to that school." So that day, I was scheduled to fly up to Newtown because we were going to make a public decision about how to move forward. And when I walked into the city council chamber room, which was about a third of the size of this room, there were hundreds and hundreds and hundreds of townspeople lining all the walls. There was news folks all around. And I walked to the center of the room and I said, "We're clearing the room. For the first time ever, we're going to hold a private meeting." And everyone left, and in walked the 30 teachers. In walked the 30 teachers. And for the next hour and a half, I heard the most harrowing stories about what those teachers did. I won't take you through all those, but the most harrowing stories of what they did and how they saved so many kids and how they watched so many kids die and how they watched so many of their colleagues get gunned down. When we came back into the room, everyone came back in, and again, standing in the middle of the room, I said, tonight's not the night for a decision. Let's take a 2-week break and we'll come back. When we came back 2 weeks later, every meeting started about 6 or 7 o'clock at night. It was now midnight, and the task force was gridlocked, a third, a third, and a third. We couldn't get any movement. All the people told us, including the news media who interviewed me before the meeting, saying, "You see, we told you this could never happen," much like in Reading. "We told you it could never happen. We told you it was too hard. We told you there was too much trauma. We told you there was too much division." And over the course of the next couple hours from midnight on, we kept talking, and then finally there was one man on the task force who raised his hand and said, "If I move this far, will you come meet me part of the way?" And lo and behold, we broke the gridlock. He broke the gridlock. And over the next period of time, people worked out a solution. They hammered out a solution. And finally, when we took a vote, it wasn't 49 to 51. It wasn't 75-25. It was a unanimous decision to tear down that school and begin anew. Here's what I want you to take away from this story. I could keep talking about Newtown forever. But in our country, in our lives, as Americans, we have become so practiced at saying no. You know what I mean? We have become so practiced at casting aspersions at one another. We've become so practiced at creating obstacles to moving forward. We're real good at it. I think one of the things we've got to get better at is saying yes. Saying yes to moving forward. Saying yes to seeing one another. Saying yes to realizing we're going to have to work together to get things done. Saying yes to realize we're going to have to compromise. Saying yes that we're never going to get everything that we want. Saying yes that we're going to have enough humility to realize we don't have the answer to every problem ourselves, that we need each other, that we got to go together moving forward. And so that, to me, in the most inexplicable, most horrendous, most horrific situation, the people in Newtown were able to rise up and figure out, amid their trauma, amid their despair, amid their loss of hope in the moment, that they would take a step forward and keep going. Which makes me think of one last thing I want to tell you about that gives me hope, and that's Selma. I was just back in Selma a few weeks ago, a year to the day that I made my first trip there. I was invited to be the keynote speaker for the NAACP's annual banquet to celebrate the Voting Rights Act. And while I was in Selma, I got to talk to many more people. And I started to realize that so many of us make pilgrimages to go over the Edmund Pettus Bridge, right? Every year we go down. Sometimes our churches go, other groups take us. And the people in Selma like that. Keeps the community moving. But I think for so many of us, we see the bridge. And then so many of us, when we go to Selma, what we see is the disrepair. We see the empty storefronts. We see the housing that's falling down. We see the homeless people on the street. We see the potholes in the road. But I ask you, is it enough just to see the bridge or to see a community in disrepair? When I go to Selma, what I see are the people. I see the people. I see people who are coming back to Selma to help rebuild it. I see people who are coming together to put up new homes. I see people who are coming together because they have a fighting spirit to move this community forward. In Kentucky, do we see just the disrepair? Do we see just the problems? Or do we see the fighting spirit of people in Appalachia? Do we see the fighting spirit of the folks in Owensboro? Do we see the fighting spirit of the folks in Clark County or Paducah or down by Fort Campbell? That's what I see when I come to Kentucky. I know there are challenges. In Owensboro, I'm dogged by some groups that don't want us there. But I also see people stepping forward because they want to improve their community. You still with me? You sure? I can stop. You know, this campaign I'm on, it's funny, I used to manage political campaigns. On this campaign I'm on, when you run a political campaign, like the presidential race that's happening now or congressional races, you go to where your voters are, right? You either go to Republican strongholds, red areas, or blue areas, and then you find that sliver of undecided voters and you go after them. We're seeing it happen right now in the presidential race. It's interesting, in this campaign that we've been running, I was just in Matt Gaetz's congressional district in Florida. You know who he is? I was in Jim Jordan's congressional district, the co-founder of the Freedom Forum. I was invited there to speak. I was recently in Lauren Boebert's new congressional district in Colorado. You know who she is? I was in Flint, Michigan. I was in Jackson, Mississippi. I was in Stamford, Connecticut. I'm leaving here to go to Clark County. Then I'm going to California. Then I'm going to Florida. I ask you, why is it that all these different places, Republican strongholds, Democratic strongholds, purple areas, have all invited this campaign to speak in their local community? Here's one thing I know. It's not because they think I'm a nice guy. I think it demonstrates how hungry we Americans are for a new path forward. That we are sick and tired of the divisive politics. We're sick and tired of the acrimony. We're sick and tired of the hatred and the bigotry. We want to find a new way forward. What I hear from Americans over and over again is that we want a greater sense of belonging. We want a greater sense of connection. We do want to find common ground amid our real differences. We want a greater sense of acceptance. At least most of us want a greater sense of acceptance. And that's why I think this campaign's been invited to so many places. So I want to just talk about 4 quick things that I think if you want to create, as it says, I'm looking, can't find it now. The tagline for this conference is building common ground for a path forward, or something like that. Finding common ground for a path to better health. How's that? Not bad. If that's what we want, then I think we need to focus on some things moving forward that will enable us to create the conditions for that to happen. Simply wishing for it, simply all of us sitting here, simply all of us going back and working harder and running faster is not going to do it. I think how we do the work is as important as what we do. And I want to talk about 4 things about how we do the work. You with me? You sure? I can't hear you, Kentucky. You sure? Yeah. All right. Number 1, I think we need to turn outward toward one another. Now, we are all, as Americans, hunkered down at the very time we need each other, at the very time we need to go together. We are hunkered down and turned inward. And turning outward sounds easy, but you all know it's difficult. It's difficult in our personal lives. It's difficult in our organizations that are usually turned inward, often turned inward. It's difficult in our communities and in this country. Turning outward, first and foremost, is a mindset or an orientation. It's a choice about what direction we are going to face. Are we going to face outward toward others and make others the reference point for what we do? Or are we going to turn largely inward toward ourselves, our own organizations, our own strategies? We've done millions of dollars of research on this, and most organizations and most Americans, unfortunately right now, are turned inward. Not all, you're all here. But many of us, without even knowing it, are turned inward. And to turn outward, one of the first things we need to do is to engage folks differently. As you know, so many of the issues in our communities are politicized. They become politicized, and we are asked to choose up sides before the issue even gets talked about very much, right? And before you know it, we're battling each other. We have toxicity we can't get rid of. We're in gridlock. I think if we want to move forward, we have to start to frame issues in a fundamentally different way. Not around politics, not around our problems, not around utopian visions, but around our shared aspirations for what it is that we want. And if you ask anyone about their aspirations for their lives or their community, what they will tell you is something from their gut that matters to them in their daily lives, and that is actionable, doable, and achievable. That's how the work in Reading moved forward. That's how the work in Clark County moved forward. That's how the work in Owensboro will ultimately move forward. The other thing is when we talk to people about their shared aspirations, all of a sudden they realize amid our differences, we do share some things in common, enough to get moving on. When we focus on our shared aspirations, we realize there is no one organization, no single leader who can solve these problems on their own, that we need each other. We're all implicated in this. When we start to focus on our shared aspirations, we move from being consumers of public life, where we expect someone else to do everything for us, where we are now members of a larger community belonging to something bigger than ourselves, and now we can see ourselves as an active player, an active partner in moving forward. So to move forward, we're going to have to focus on our shared aspirations. We're going to have to talk to folks we've never talked to before. We're going to have to engage with folks who make us uncomfortable. We're going to have to cross divides that we're typically unwilling to cross. But I'm telling you, there is no way forward without doing this work. Not in my experience. So the first thing is we've got to make, you have to make, each of us needs to make a commitment to turn outward toward one another. And one small step in doing that is how we engage with one another. Second, we got to get in motion. There is a whole industry in America right now saying all we need to do is hold more forums. If we just talk more, we're going to be fine. National foundations are funding this work everywhere. There's new programs, new initiatives. It's everywhere. I get calls every day to join these efforts, and I reject most of them. Here's why. Talk is important, much like focusing on our shared aspirations, but I'm telling you, Americans are sick, and Fannie Lou Hamer said, I am sick and tired of being sick and tired. People are sick and tired of all the talk that goes nowhere. I am. Are you? There's too many health disparities in this state. There's too many inequities in this state. We got some work to do. You don't get work done by just talking. So we got to get in motion together. And the reason why I believe getting in motion is so important is because when we're in motion, we begin to discover things about ourselves and one another that we couldn't discover simply by sitting around a table. We begin to discover that we have innate capacities we never knew we had. That's what happened in Reading. They didn't get new money to do that work. They changed what they were doing and realized they had a lot of capacities already. It then attracted a lot of grant money, but that's not where they started. We begin to realize that people have talents and gifts to offer. We begin to realize that there are folks we can work with we never could have imagined working with, and we I hate to say this, but we start to realize there are folks we're working with we ought not to be working with at all. They're holding us back and holding us down. It's time to move on. When we get in motion, we begin to realize we have a sense of personal and shared agency, which is one of the biggest things people in America feel like they're lacking today. They feel like they've lost control to shape their lives. It's all about agency. When we're in motion, we begin to see that we have agency. So the first one is we've got to turn outward. The second one is we've got to get in motion. Here's the third one, which is somewhat counterintuitive. We've got to start small to go big. We got to start small to go big. Now, in our country, we love big, shiny things. We love comprehensive plans. We love really expensive projects. We love all those reports. But what happens to them? Too often, there's a downward trajectory of momentum. They start with great fanfare and they fizzle out. Create skepticism, cynicism, frustration, a lost sense of hope. At the Institute, we undertook a 30-year impact study of our work a number of years ago. We looked at 9 different communities that we had worked with. And we especially focused on what happened after we stopped working with the community and they kept going for the next 5, 10, 20 years. And here's what we learned. Most of those communities, I wrote a book about this. I'm not trying to hawk a book here, but you can buy it outside. Most of those communities created systemic change. But they always started with small actions. And those small actions always enabled them to catalyze and unleash a chain reaction that grew and spread over time. And as it grew and spread over time, they not only produced change on what matters to people, they changed the civic culture of their communities. And as this began to happen, people began to see it, they wanted to be a part of it, and it started to spread like a positive contagion in each of these communities. I think in our communities, we all want systemic change. I do. I'm not interested in just small actions. But what I am interested in is effective action that can be sustained over time and that we can build on over time. And so I think one of the things that we need to do as actors, as civic actors, is give ourselves permission to start small and to grow those efforts over time with greater intentionality. Last point. I think we need to create a new trajectory of hope. A new trajectory of hope. Many of the people I work with in communities all across the country believe that, I don't know if you share this, that they need to solve everything at once. If we don't solve everything at once, we failed. That we need to be all things to all people. You ever feel that way? That people are asking you to be all things to all people? I think we have to wonder what gives people hope in our communities, in our lives. We've done a lot of work on this. It's not that they believe that we're going to solve all these problems overnight. People know that it took a long time to get here. And they're tired of empty promises that say we're going to solve the health problem or schools or other issues overnight. What they want to really know is, are we really dealing with the issues that are in front of us? Are we really coming together in effective ways? Are we beginning to make progress on these? Are we moving in a more hopeful direction? That's what folks want to know. Here's the challenge. So many folks that I work with, including folks here in Kentucky, are so hard at work at doing the work that you're doing that it's invisible. Now, the award winners had the benefit of winning an award today, so it's more visible, which is fantastic. But for so many of us, the work that we're doing, the daily grind that we're in, we've got our heads down, we're plowing ahead, and we don't even see that we're making progress sometimes. And beyond that, many foundations, because they have metrics and other requirements, or many of your funders, if you're in government, don't want to know about your progress until all the work is done. Except the progress that we're making along the way is what actually enables people to have hope. Remember, it's called a trajectory of hope. So I think we need to make this progress we're making more visible to ourselves, and I think we need to make this progress we're making more visible to others in our community. So at the Institute, we created a tool called Making the Invisible Visible that enables us to discover the progress that we're making and what we're building, the work that still needs to be done, and the path that we're going to take moving forward. You can download it from our website for free. It's a great tool. It's a great tool. You still with me here? You sure? You don't look like it. So turn outward, get in motion, start small to go big, create a new trajectory of hope. So let me just end with a few other thoughts. In my faith, I'm a person of faith. In my faith, like in many faiths, there's a teaching. It goes something like this: if you save one life, you save the world. If you save one life, you save the world. I've always wondered why they teach us this. If you save one life, you haven't saved the world. We all know that. It's obvious. Then why do they teach us this? I think they teach us this because if you save one life, it means that you believe in the dignity of each and every person. That if you save one life, it means that you value other people, not just yourself. If you save one life, it means that you've turned outward toward other people. If you save one life, maybe you've reached out to someone who's different than you. If you save one life, maybe it means that you've gone to bat for someone else against the odds. If you save one life, it means that you're going to keep working at something over time, that you care about something larger than yourself. I believe that we are meant to go together. And I think one of the reasons why they teach us, if you save one life, you save the world, is to remind us that we are meant to go together. As human beings, we are not meant to be alone. We are not meant to be in isolation. We are meant to be in relationship, working together, caring about each other, supporting one another, moving together ahead. Which leads me to a personal experience where I experienced this myself. When I was born, I was diagnosed with cystic fibrosis. In 1960, that was a death sentence. My parents were told I had 3 to 5 years to live, so they went on a death watch. There was a point at which a doctor turned to my mom and said, "Face it, he's a lemon." No one ever expected me to make it this far, and I certainly never expected to have the honor to speak before you today, especially about a healthy Kentucky. I spent much of my youth and a good part of my adulthood in hospital beds. I have vivid memories of all the doctors, nurses, and specialists all surrounding my bed, talking about me, but never talking to me. I experienced firsthand what it feels like not to be seen and heard, what it feels like to be stripped of your dignity, what it feels like to believe that tomorrow will not be better than today, is likely to be much worse than today. But I was lucky. I considered myself lucky. One is that my diagnosis changed over the course of my lifetime, unexpectedly. But I was lucky because there were 3 men in my community who'd never met each other. I grew up in a small town in upstate New York, who never met each other, but who made sure I didn't fall through the cracks. There was my next door neighbor who worked on the assembly line packaging Cheerios for General Mills, who had a workshop in his backyard. And he would take me into that workshop, into the wood shop, and teach me how to build things with my hands, to teach me that I could be a builder. There was another gentleman 4 blocks the other way who was an electrician at a local plant. And he used to take me on errands with him on weekends, sometimes to our synagogue. I'm Jewish. And he would set up a ladder and ask me to climb up the ladder to fix something in the ceiling, like a connection. And I always thought he was trying to teach me about how to be an electrician. But what I learned from that experience is that he was trying to teach me that I could keep stepping up and rising up and didn't need to fall down. there was a coach I had, Mr. Rivers, who coached me in basketball and baseball for all of my youth, who was the first adult who taught me that it was okay to have hope, and that notwithstanding my physical ailments, that I could exert myself on an athletic field to the point where I was recruited to play ball in college, all because of Mr. Rivers. Each of these three individuals who never met each other, who didn't know each other, saw a young, vulnerable kid who was going to fall through the cracks, whose parents were wildly overwhelmed and out of money, who stepped forward and made me realize at a very, very, very young age that we are meant to go together. That community only works when it's a common enterprise. That community means all of us, not just some of us. That these were three individuals from different walks of life, with different experiences, two of whom had no money themselves, who made a commitment to some young kid. Now, I believe this is in part the story of America. This is the story of America. I love this country. And there are lots of folks, particularly my friends on the left, who cringe when I say that. But I really do love this country. I love this country so much, I'm not afraid to say we are founded on original sin. And we have work to do to reconcile our past and make good on our past moving forward. But here's what I love about this country. This is the last thing I want to say. I love this country because we refuse to settle. So many countries just settle. We refuse to settle. We keep moving forward. Sometimes it's 2 steps forward, 1 step back. Sometimes it's 1 step forward, 2 steps back. We all know this. Nothing's easy. But we keep moving. We keep moving. We keep striving for a more perfect union, knowing we will never reach it, but always seeking to strive to get there together. All across our country, the change that got created always got created in local communities. So much of it got created in local communities. It didn't get created in Washington, D.C. It didn't start there. The Voting Rights Act didn't start there. It didn't start in Frankfurt. As important as these places are, it started in our local communities, where people were meeting in places like this, where people were meeting across backyard fences, where people were meeting in church basements, where people were meeting in civic halls. The change that has gotten created always started in local. Think of the American Revolution. I was just in Philadelphia giving a speech. It didn't start in Philadelphia. They couldn't agree on anything in Philadelphia. The 13 colonies did not agree on very much. But what we did agree on was that we wanted King George the hell out of our country. And so people came off of fields and farms and small towns without an internet, without mailing lists, without a lot of money, without uniforms, with a common purpose, and they fought. It started in our local communities. When we finally faced the scourge of slavery in this country, it didn't start with Abraham Lincoln and in Washington, D.C. It started in our local communities, in church basements, with people talking, with people working together. It started in our local communities by people going together. When we passed women's suffrage, it didn't start in Washington, D.C., or even Albany, New York, where Seneca Falls is not too far from. It started in local communities by people banding together and moving forward. When we passed voting rights and civil rights and gay rights, they all started in our local communities. My message today is simple. We don't need more divisive politics. We need a new civic path forward. It begins in our local communities. It begins here in the Commonwealth of Kentucky. It's the work that you're doing. It's the work we need you to do. We've got much more to do. Thanks so much. Yeah. There's microphones on your table. We'd love to hear some questions. Disagreements are good too, or different perspectives. Anything. Great. Just make sure it's on. No, press it. There you go.
Sorry.
You want it to be green.
Yes, you want it to be green for everybody who's never done this before. Good morning, Taylor Ryan, she, her. I'm with Change Today, Change Tomorrow. I feel like we say a lot of the same things you say, except for you're white, and we don't get any positive responses. Any feedback you can offer? Do we just need to get a white man on our staff? Like,
I don't know. You telling me I just wasted my time?
no, I'm asking genuinely, because whole 4-point plan, everything you're talking about, we do and we talk about vocally with everyone, and they laugh at our faces.
Yeah. Look, I think we need each other. I think there are rooms that I can't go into very effectively, and there are other rooms that other folks can't go in as effectively. And I think we need each other. That's why I think we need to go together. And so, and I'm sure you're doing this, but I think to me this is part of the work of building allies, and engaging one another strategically to help us make progress. And I don't know, in a lot of the places where I work at least, so I'm just gonna talk about that, Taylor, we're not engaging each other strategically. We're not. We're not really, in Lexington, one of the things that we said is you all have a real nice history of getting together but not working together.
Woo.
Like you want to talk a lot, you have plans a lot. This is not uncommon for other communities. Good thing Mason's there because he's fixing some of this. But I think this is true also in the types of things that you're raising. I think we all get together a lot. We have conversations. I don't know if we have enough hard conversations about how we're going to move stuff forward and what that's really going to take, and who needs to be in the lead at different times,
Right.
or who needs to be walking beside one another at different times, about who people can hear. There's no question that people of color come up to me all the time and say, you're a white dude over 60, why don't you go into that room and say what needs to be said, because they're going to listen to you. I get that, and I go, because I think that's one of the things I can do. But we got to make sure those rooms get open for other folks too. It's not just about me walking into that room. And I think too many folks that I know are walking into that room and they're not looking back. And they're not clear about why they're really there. So, does that help? Yeah. Al?
Thanks, Rich.
It's good to see you.
Yeah, good to see you. You're speaking from the community level, and I agree that big change usually starts at the community level. But in your experience, have you seen any sort of statewide impact that has grown from a community effort that's been successful?
I'm trying to jog my memory here, but we worked on healthcare issues in Georgia, and there were things that I don't think we had the right strategy, honestly, but I think there are things that emerged from that. I think there are things that emerged in Mobile, Alabama, around education that impacted state policy. I think what it requires, we're talking to the Kansas Health Foundation right now about this as well. I think what it requires is, as you know, is getting enough work done in local communities to begin to change the conversation and build public will, and then finding out what we can peel off that we can begin to make progress on, let's say, in an agency. Ben and I were talking about this last night, or in the state legislature. And so I think it's both those approaches that we're going to need. So.
I just wanted to comment that there was a session this morning on NPR about how do you get community engagement. And it really focused on one thing. It's the ability to make that initial connection. Understand that the people that you're working with and the people that you want to work with also have wishes and desires that they want to work on or that they want to do. And there are so many people who've given up because they've tried, and things just don't work. I know in my case, I'm working with health agencies in Louisiana right now, and they have such a morass of political issues that it's extremely difficult. But we're working, we're working with one agency, and they are making a difference in their community, and they're slowly starting to grow. It's almost like a cancer, because they've gotten people who don't talk together to talk together and work in the same direction. And it really does work. That's all I can say.
Yeah, so to me, that's sort of this chain reaction that you've just sort of articulated, this chain reaction in a certain way. You use the word grow 2 or 3 times. Things keep growing. So again, I think for me, what's really important is, I didn't hear that segment, is I think a prerequisite to moving things forward is we've got to find enough common ground to figure out what we can begin to move on, right? And so I think that's really critical. I just want to underscore again that 2/3 of your story was about moving forward after we found that common ground. And I think that not enough of our work in communities actually works to move forward. Right now, we're so consumed by these conversations. So I want us to keep our eye on the ball that you just, the picture you just articulated, which is, let's have the conversations and then let's move and let's grow that work over time and figure out where we can get started, which is that one agency you mentioned. And let's grow that. You said it's spreading like a cancer. I would say it's spreading like a positive contagion, right? But it's the same principle. It's the same principle. And I think that's really critical right now. But that requires, you know, what, at least in our work, what we found is that requires a level of intentionality. It requires a level of discipline, of keeping your eye on what you're doing. It requires a level of being a scout. Like, where can we be opportunistic and pick off things that we can do because we have a sphere of influence, or because someone's ready to do something that we never dreamed of doing. All the work around English as a second language and writing, no one planned. It got started and then it just kept unfolding in ways no one ever could have predicted. And that's really important. We have to be open to serendipity, to the unexpected. We live in a society that's rooted in planning. Like, know everything before you do it. And I like planning too, but there's a limit to how much we can plan in an organic system. And so I think that's really important.
Hello, it's really nice seeing you again, and thank you so much, Richard. I was over here bawling. My mentor got to see all of that. So I do want to tell you that this has been very impactful and not fleeting. I want to not question a framework, but I want to kind of dig into it a little bit, if you allow me. So my brother was murdered on September 16, 2018, and I think we have just unfortunately went through his 6-year anniversary of being murdered in Colorado. And I helped to work on the Bipartisan Safer Communities Act to pass that congressionally from 2020 to 2022. But then I wanted to understand if I would have really understood as a child what civic education and civic engagement would do, it could have possibly saved my brother's lives and thousands of lives and millions of lives. And what you talked about, just saving one life has a ripple effect, not just through our standing as human beings, but it helps us be better as a collective effort. So what is happening with our civic education, our civic engagement in our schools, and how do you feel about not having that type of investment? Intentionally, it has been taken out of our schools. We learn about the 3 branches of government, but it doesn't go any further than that. I myself have challenged that by creating an organization for youth center policymakers for us to look at these projects. So we're not looking at this latent period and getting together at the very end and feeling that hopelessness that you had talked about. How do you feel about that?
Well, first, I'm sorry for your loss, and that never eases. I think is a huge blunder. We teach ourselves every day to be really good consumers. We don't teach ourselves every day to be good members of a community, good citizens, whatever word you feel comfortable with. And to your point, when we do, we often, not always, want to just sort of keep imparting facts to people, and that's good. That's necessary, but not sufficient. You probably know better than I do that I think there are a number of new efforts. I know, for instance, like Peter Levine up at the Tisch Center at Brandeis, I think it's Brandeis or Tufts, is working on new civic education work. That's really promising, and there are others. So I think there is an increasing, I just got a call from the president of American University about this. I got a call from Emory University about this. So I think there's an increasing recognition that we're missing something, that we have failed, if you want to talk about it in terms of young people, we have failed to engage our young people in a way that fosters a sense of belonging, a sense of agency, a sense of what it means to produce change together, create change together. And so, yeah, I think we need to spend a lot more time. It may be that my experience with public schools, because we've done work on education issues since the day we founded the Institute, my experience with public schools, not all, but most, is the best change typically starts outside and moves in. So I think we need organizations like yours that are doing this work that can demonstrate what it looks like. And then this sort of goes to Al's point in some ways, which is at that point, maybe it can be adopted and adapted in a larger scale. But last thing I'll say about this, scaling things is not always the answer. Because a lot of times when I work with national foundations a lot that try to scale things, and in their scaling, they lose all the context. They lose all the local feel for what they're doing. It doesn't meet people where they are enough. It has to be, by definition, almost cookie cutter. And so I think we need to be careful about what we're choosing to scale and how we're doing that. So.
Hi, thank you. On your first topic on how you work, on a foundation level, we've tried to reach out to new partners that we haven't worked with in the past, talk to people we haven't talked to in the past, and we found ourselves partnering at a leadership level with other foundations who may be working on common issues as us, we're a health foundation. Which on one hand is great, but some of the new partners that we're running into might be putting a lot of money into issues we care about, but it might also be actively harming other populations that are priority populations. Do you have any suggestions on how to navigate that balance?
Yeah, well, we've created, Allison knows this, we've created a circle of funders from across the country, including the Gray Clark Foundation, that want to do business differently in communities, both at a state level and at a local level, and nationally. We have national foundations involved too. And, my short answer is, there's a longer answer, but my short answer is that not all partners are good. I think there can be an impulse or an implicit assumption that the more partners, the better. And I've come to believe actually less is often more. So that's number one. Number two, in doing that, I think there will always be, this goes back to Taylor, right? To Taylor's question, or my response to it in part was, there will always be, we will never be in perfect alignment when we're working together in partnership. So I don't think that should ever be the goal. I do think that there needs to be enough alignment around some basic values. For instance, when we're working with folks, I want to know, are you turned outward? I have diagnostic questions I can ask them. Do you have a desire to turn outward? Do you actually believe in do you really value the community's voice, or are you just saying that? Do you always need to be in the lead? Because a lot of this catalytic work for funders is not being in the lead. It's actually walking beside or behind people. Do you have some notion of what change looks like? As the gentleman from the back was saying, really, it's kind of an emergent. It's often emergent. Well, that requires that you engage in certain kinds of ways. You can't always force it. Sometimes you do need to force it, but you can't always force it. So all this is to say is, as you're developing these partnerships, really you want relationships. And the question is there enough alignment around some of these basic things? The third thing is, are we creating a space where there are strong enough norms to have real conversations about things we don't agree on, and that things we really need to work through together? And I don't see enough of it. There are spaces like that, but there aren't nearly enough of them. And we think we're doing it, but we're often not doing it. And so those would be starting, I think, some really important starting points. For groups that you're working with that you think are doing, I just gave back $2 million to a national funder. Because I believe that they were asking us to work with communities and in communities in ways that would harm communities. I think you have to ask yourself, are you willing to walk away? Because I think there are times when we need to walk away. Hopefully not very many, but I do think there are times when we do, and we need to know under what circumstances and why, and how can we do it in a way that doesn't destroy the relationship, but make clear that we value certain things, while you're still always keeping the door open. And I think that's really important.
Hi. So when you talked about your experience with disability, I feel like that's something that I and other people with disabilities
Can you just speak into the mic a little bit more?
Yeah, sorry. When you talked about your experience with disability, I feel like that's something that I and a lot of others have experienced with being talked about rather than talked to by doctors and other medical professionals. So do you have any advice for how to kind of make peace with the situation, or maybe take back your power, I guess, as someone who has kind of gone through that? Because I feel like in the medical world, disabilities aren't always treated with the utmost respect or care. So how do you kind of deal with that? Do you know what I'm asking? Sorry.
Yeah, I think that's a great question. I think, for a lot of folks, we don't have choices about who our doctor is. Right? There isn't a lot of choice. So for someone to say, well, just pick a better doctor, they're not dealing with reality. So I think that's a challenge. I think, I wish as a kid, I can't tell you the number of emergency room triage rooms in ERs I went through. And one of the reasons why I'm so interested in questions that I discovered later on in my life was because I was destroyed by nurses and doctors asking me questions that never got at what I felt or was experiencing. Right? They were looking for vital signs. I was terrified. They were looking to see how they could fix me. I needed a hug. I needed someone to love me. I wish at that point I could have said, slow down, you're not asking me the right questions. I do that now, but I'm 64 years old. So I think, to the extent that we can teach people, I think asking a really good question is better than having the answer usually, because it opens up things that we never could have imagined. So I think teaching ourselves, teaching young people, teaching patients, I don't even think of them as patients, people, how to ask better questions, how to have the courage to ask those questions, particularly when they're scared. I think finding ways to have people come with us, this goes back to I think we need each other. Like, I think I don't want to go on for too long in this, but I've talked to medical residents, I talked to residents about this who are training to be doctors, about how fearful people are sitting before them, how much they're often trembling, right? How at a loss they can feel. And so when you're in that state of mind, and it really is a state of mind, you don't always have the ability to ask questions. You definitely don't always have the ability to hear what someone's saying to you and make sense of it. It's very hard. So I think we need each other. I think we need to go into these places with other people who can help us. And that requires the person who's suffering to be vulnerable enough to sit, which I never did. I detached. I went by myself. At 8 years old, I decided I would never ask another individual for help in my life because I kept getting hurt. We need to be vulnerable enough to say, I need help. I need you to come with me. I need you to advocate for me. I need you to support me. And sometimes I just need you to love me. So.
A true disconnect between those people that may run boards, that make a lot of decisions for whether it be hospitals, foundations, that philanthropic foundations that give away funds and whatever, from grassroots needs in different communities. And one way to provide input is to have people or subcommittees that work with boards where you got people that if you have people with disabilities and they feel that they're not getting proper care or not heard, if you've got persons of color that can serve on committees, and they can, but we don't go deep enough. We want to work with people who are socioeconomically the same level, whatever else, and you still are not working with those grassroots level that can resolve those problems in the communities like where I'm from. Live in Louisville now, but I'm a rural Kentucky girl, okay? And I have family that need health care. They're going everywhere to get it. It's not just there. So there's these inequities, but we don't have representation. If you look around this room, I can count the people who might sort of favor me, okay? So where are we? Where are the people that may have disabilities that could serve on committees? You will not have the input if you don't go get it. And I agree with everything you said because I've done true engagement. People feel disconnected, they feel people don't care, but we come, if there's a dollar to be made in the community, we'll come and build big new shiny buildings, and of course we'll go running, but is the service there for you? And I want it for everybody. That's my sermon for today.
We probably could have saved a lot of time if you had just come up here at 9:15 and started talking. Thank you. Yeah, it's really interesting. A lot of the organizations that we work with that want to do change in communities, or Al, to your question, in states, when we start to work with them, what we begin to realize is they actually don't have the relationships they think they have. So when we say, we want to engage people in different pockets of the community, and they say, well, we can do that, and then they realize, well, actually, we don't have the relationships to do that. We don't have the trust to do that. We don't have the credibility. We're not rooted in that way. So I actually think one of the things that organizations need to be thinking about at different levels, there are different ways to do this, as you know, depending on your focus, is what relationships do we really need to do the work? And we can't be all those things, which requires a humility on our side, on the organization's side, to realize that we need other groups. We need to be in relationship with them. It means we have to talk to them, not just order them around. So that's one thing. The second thing I would say is that even when we have those relationships, and you know this better than I do, but even when we have those relationships, sometimes the groups we have relationships don't actually know their communities all that well. And that's why I think engaging, like in Reading, if we didn't engage everyday folks around English as a second language or early childhood education, I can guarantee you that they would have been pursuing the same strategies they had before we started the work, which were not producing results and did not meet people where they were. They didn't. So I think, and to do this, we can do some of this ourselves. Some of it we're gonna have to do in relationship with other groups that can help us do this, so absolutely. But I think as you know, there are practical things I think we can do to make this happen.
Good morning, Rich. This is Debbie
Where are you?
back here.
Oh, hey, Debbie.
I know we're talking a lot about organizations, and I'm hearing some kind of overtones about organizations working with other organizations and other groups working with other groups. And I'm trying to separate myself from where we are in the journey in Owensboro. And there's no way that you have time to go through the process with all of us here today. But I think the important thing is what you just hit on is we're not talking about a framework that is designed to help groups get along together or organizations to partner and work better together, although that will happen by default. You're talking about community and community members. And one thing, if we have time to highlight it, is when you first start working with a community, that process of bringing all community members across the entire community together to have some really tough conversations and just to hear from one another and to listen. And the one thing that keeps kind of going over in my head over and over this morning is what's important to you. And this is not what's important to the CEO or to the board members or to the foundations in your community. This is Jane Doe, John Doe, all of the folks in your community, what's important to you. Can you talk about that step, at least for this group, in terms of understanding that, yeah, this is a process, and it isn't a process among your usual suspects of getting foundations and groups together and how are we going to do this, but it does focus on the everyday citizen. And I think I'm just hearing a lot of group to group kind of things.
Yeah, I think I would imagine some of you do what I'm about to say already, and some of you could do it, or maybe strengthen what you're doing. I think, if you can work on a community level, you can work on a neighborhood level. We've worked on state levels. We've worked on the national level. So this scales up and scales down. But the same principles basically hold, which is, do we really understand who lives in the community that we're working with? We're not working to the community, we're working with the community. And do we really have an understanding of how people, where people live, what their lived experiences are, how they imagine their lives? And I think that's really critical. That's more than data, right? I think when we begin to engage people, unfortunately, and I'll leave present company out of this, but what I see typically is we say we're going to engage people, and then we hold a town meeting, we bring some experts in, and they talk at people. There's a role for that, but that's not what I mean by engagement. There are places where we say to folks, we have a solution we want to try out with you. There's a role for that, but that's not what I have in mind. There are places where we come in and we say, we have 3 options we want to test with you. There's a role for that. I've done that. But that's not actually what I'm talking about today. What I'm talking about today is, how do we create a space where we can ask people what it is that matters to them in their lives, in their community, and start with that, not with our topic, but with that. The reason why we need to start with that is because we need to understand the context of people's lives. What is the context in which they live? What really matters to them? What's their starting point? How are they constructing meaning in their lives? We need to understand that in order to understand what it means to move forward and go deeper. I think from that we can start to ask people about their concerns, We can ask people who they trust. We can ask people what signs of progress would look like. There's a whole bunch of things we can get into. But these are open-ended questions that have a structure, but are not rooted in people's problems, nor in visioning exercises, but in what really matters to us. We're trying to get to what matters to people. And what's really critical about this, as you know, I would imagine that many of you have to do work with issues that are already predefined by law, by agency, by some foundation group, right? These things get predefined. As you know, if I asked you about your life, you would start talking about multiple things at once that in your mind and lived experience are all connected, right? They're webs. And what we are trying to figure out in this work is what are the webs that people are dealing with in their lives? Because that's what we need to address in order to address things that are of meaning to them. That requires listening differently, asking different questions, listening differently, and then taking action in different ways. And that becomes really important. So I hope that's a quick answer. All right. Is that enough? It's not enough. It's going to be close to enough. Here we go.
I've been waiting on this moment. Okay, so like you said, gathering people in spaces, having conversations. I'd like to pose a call to action to the space because that's what we do. I don't know if you've ever been around Taylor Ryan and Change Today, Change Tomorrow, but when we get in spaces like this, several people in here are decision makers. What we've been struggling with for the last 5 years is a partnership with our local food bank, Dare to Care. I'm sure someone in this room has a connection to Dare to Care. If you could, please send them an email. Let them know all the great work that we're doing and that we just received this award and we're recognized in the same city that they do work in. Every year, they deny our application. So if someone in the space feels moved, please send them an email. Call your friend. I know they're your friends. And absolutely come talk to me.
Yeah. All right. Thanks so much for hanging with me. It's great to be here. Really appreciate it.